I have the pleasure of being at the Kigali Global Dialogue in this beautiful city and fabulous country, and also an equal pleasure to speak to the Honorable Dr. Patrick Ndimubanzi, who's the Minister of State in the Ministry of Health in charge of public health and primary care. And sir, it's a pleasure to talk to you. I've been, reading about some of the work you've done and particularly listening to your TED Talk. And one of the things that really struck me is you spoke to some people during your travels, and how you said that for them, the country may have stopped in '94. And for Rwanda, the clock hasn't stopped ticking. And it really hasn't. Today, as you celebrate your 25 years since the genocide, it's amazing how much the country has developed. So can you talk a little bit about the journey as far as public health is concerned, the investments and what has happened in the last 25 years?
Well, thank you and very much welcome to Kigali. I mean, it takes people to come here to see how much the country has changed.
Absolutely.
And people who even come every year see the difference happening every year, because we are in a fast-forward motion. As you're saying, in 1994, after the genocide against the Tutsi, the social fabric of the entire country was completely devastated. There was nothing left. So from that period, people went back to work, and people went back to work with one ideal in mind, to rebuild, and to rebuild the country for the people of this country. So as most of Rwandans will tell you, it's always about the people, what we do for them, what we do with them for themselves. Initially, obviously, there was nothing in place. So people were working for free. They were actually working for free in the hospitals. They were not getting paid. But they came together with the assistance of the Friends of Rwanda, many partners who came and helped us rebuild this country. So initially, there were very few hospitals. One of the things that the country has done is try and rebuild hospitals. The guiding principle was equity. So we tried and put hospitals and health facilities in each corner of the country, because equity is the most important thing. We have three key words in our health system, in all our policy. It's people-centered, it's integrated, and it's sustainability. So not only that, because the community has also to participate, we established a workforce of community health workers, 3 in each village. Initially, and then 4. Now we've added a 4th community health workers. So we have 60,000 community health workers. 2/3 of them are women, 1/3 are men. And what they do, they help pregnant women go to health centers. They identify obstetrical emergencies and call. We have a system that we call rapid SMS, so that they can alert the health centers, and we send an ambulance to go and get the pregnant woman who's in need. They treat malaria, they treat diarrhea, they treat respiratory diseases in kids. So they have been extremely helpful. And they're all volunteers. They're all volunteers.
Yes.
And the only way they get compensated is through their cooperatives, and that's also something that's beautiful, because it brings people together. So that's one. And just above that layer of community health workers, we have what we call the health post. It's something new that we are trying to introduce to get even closer to the people. And the health post will be managed on a public-private community partnership. The building belongs to the community, and the private nurse will come and run that facility, and she will be treating a set of diseases defined in the package that the ministry issues. Above that, we have the health centers in each and every sector of this country, and the sector will count like 30,000 people. you'll have a health sector, and we can deliver in the health center. We have consultation, we have vaccination, we treat HIV, and the HIV treatment is provided by nurses who have been trained through the task shifting and task sharing model. And just above that, you have district hospitals. And in each and every district, you have at least one hospital. And that we have covered. Still the same equity motto that we have. And finally, you have tertiary hospital and so on. So that's the way we've put in place the health system, but not just access, because we needed also to make sure that people can go and get treated and without being driven into catastrophic expenditure. So that's where we established, we established the community-based health insurance. So we ensure the financial...
But just one thing, I mean, to step back, one of the wonderful things that Rwanda has also done is the amazing use of technology and also the drug delivery system. It's the way it's very streamlined, and you ensure that everyone gets the necessary drugs, including safe blood. And that's really innovative.
Definitely. Maybe the few days that you've spent here, you've realized that it's a very hilly country. It's a country of 1,000 hills.
Yes.
So some places are difficult to reach and may take quite few hours to reach. So in partnership with a company that's based in the US, we developed this system of delivering blood to the most remote hospitals. And we had a very well-established blood delivery system. But we said, okay, what's the extra mile? What do we need to do more? How can we save more lives? And how can we, for instance, ensure that we cut down on the storage? Because initially we had to send a lot of blood that would be stuck at the hospital, and we didn't know if it would be used or not. But now with the drone, you don't need to send that much amount of blood.
Just what is required.
Correct. And you just send what's required, and now we can do also other blood components, those blood components that you cannot keep for a long time in the fridge. So those as well can be delivered. We used to use like 4 hours back and forth from one hospital, and now it's only within 15 minutes. So
incredible. But I'd really like you to talk a little bit about your insurance system. I mean, you know, today universal health care is an idea that's been bought by the world over. Your president has committed to it. And so insurance-based system is one way of ensuring universal health care. And what really struck me about in your TED Talk again was that what you said was that insurance was not just about getting money. So can you talk a little bit about that?
Correct. Where we are coming from has taught us that what's important in building a country and a nation is that togetherness. And culturally, in Rwanda, the mutual aid and the community solidarity are big principles. So what the community-based insurance has done is that you care for your neighbor. You contribute for his health, and he contributes for your health. And just after the genocide, treatment was free of charge. We had international NGOs that are in the country helping with the recovery. But that went on up to 1996. After 1996, in 1997, we started charging for the services that were provided. And we realized that our population, coming from where we're coming from, couldn't afford that. So the first idea came on bringing back that solidarity. In 1999, we piloted it in three districts, so people would contribute, and we saw immediately the difference. People who were in those 3 districts really went to seek care. And then seeing that it was something that's interesting, what we did is that we extended it to the entire country. In Rwanda, we hit the pilot thing because of the equity. So what's good in the north is good in the south, what's good in the east is good in the west. So we immediately expanded that initiative. And from 1999 up to 2006, we had a flat fee. It was 1,000 for everybody. And the coverage actually went from 7% to 75% in 3 years. In 3 years.
Fabulous.
And, yes, and 85% in 5 years. So that was very interesting. But then we realized that a flat fee is not good because everybody doesn't have the same income. It's equal, but
it's not equal.
Exactly. But
yes.
It's not equal, and so the equity thing came back. We started stratifying our population into categories depending on the income that they had. So the lower income category will only pay 2,000 Rwandan francs, which is now like $2 to $3. The other category will be the same, but the higher category will pay a little bit more. So then people realized, but then the coverage rate decreased a little bit because people needed to adjust to the change. And that helped decrease the mortality. The maternal mortality dropped from 1,071 per 100,000 to 210 per 100,000, which is an 80% reduction.
Yes.
Same for the infant mortality and same for child mortality. The mortality due to HIV decreased by 82%, the mortality due to TB by 50%. So access, the geographic access, but also the financial protection will bring people in to seek care.
Yeah.
And we created that demand. We are happy. Now we need to be able to catch up because in health, the more you give, the more people want.
Yes.
It's a problem, but it's a problem we are happy with.
Because the expectations go up, yes.
Exactly.
Yeah.
So we are running to catch up with what we've created, and we are happy. So now we realize that people seek care, and if you look at the utilization rates, we're way above 1. So it came from 0.28%, 28 went up to 1. Now we're almost at 2, which is good. Almost all the mothers deliver in a health facility. We are at 91%. We're conducting a new survey this year, and we'll see where we are. But that also has implication. It means that the cost of care is going high. So government has decided to inject more money, to find innovative solution to fund it.
So how much does the government invest in healthcare?
So between 15 and 17% of our national budget is allocated to care, to health-related activities. But this year, we were thinking about injecting a little bit more so that we can catch up with the demand that the population has. And as much as we're extending and reaching out to more people, we're also treating more complex diseases as well. So that insurance will cover, for instance, for dialysis, for the acute renal failure.
Yeah.
We are looking into how we could cover for some type of cancer as well as we are facing the epidemiologic transition.
Yes.
So those are things that we constantly need to adjust on.
Absolutely, and I think Rwanda is also tackling cervical cancer in a big way, where you hope to eliminate it. And honestly, it's fabulous. In the earlier panel discussion, everyone was talking about a sense of belonging, that when you create a sense of belonging and you create a sense of community, partnerships, success is there, but also it's the leadership and the vision. And I think what I'm really amazed to hear is the sense of accountability and ownership that you feel towards the program, and it's really incredible to see that.
I think we owe it to our people.
Yes.
We owe it to our people. It's our only duty to make them at least live a decent life, and not just as pushing things to them, but also asking the community to be involved. So it's inclusiveness, but it's also participation.
I think the world has a lot to learn from Rwanda. Thank you so much, Dr. Patrick. Really wonderful.